Disability Rights Arizona presents an overview of self-advocacy for personal care needs.
Animated icons, text, and characters act out what the narrator describes.
Do you or someone you know need personal caregiving services at home? This video will go over attendant care options in Arizona through Arizona's Medicaid programs, including Arizona Long-Term Care System, ALTCS, and hiring a direct care worker independently. First, let's talk about getting caregiver support through an agency. This requires enrollment in an attendant care agency, which can provide attendant care, personal care, and homemaking services. Attendant care includes tasks like meal preparation, going with someone to appointments, and just in general, being a companion. Personal care covers tasks like helping with bathing, and dressing, and using the restroom. And homemaking involves light housekeeping, like dishes or laundry. To start, inform your AHCCCS, ALTCS, or DDD case manager or support coordinator about the care you need at home. Include details like hours of care needed, tasks you need help with, preferences for caregivers, like their gender, skill level, or experience. Your case manager or support coordinator will connect you with a contracted attendant care agency. Once enrolled, you'll be assigned a care coordinator who will help to match you with caregivers. You can request interviews and decide who is the best fit. If an issue comes up, such as unsafe or disrespectful behavior, contact your care coordinator immediately. You can also enroll in more than one agency if staffing your direct care hours becomes a challenge. ALTCS member-directed options allow more control over how services like attendant and personal care are provided for ALTCS members living at home. These options are not available for those in residential facility settings. Contact your case manager for more details. Another option is called Agency with Choice. Using this option, you and the home health agency share responsibility for managing your caregivers. The agency handles hiring and firing, while you can take on duties such as recruiting, managing, and training caregivers. You can also take on duties like dismissing caregivers if you want to. Self-Directed Attendant Care Program, SDAC. In the SDAC program, you become the legal employer of your caregivers and take full responsibility for hiring, training, and managing them, with administrative support for payment processing provided. This can be a good option if you know what services you need and want control over the services. And finally, you can choose to find your own caregiver without support from an agency. If you do, you take full responsibility for recruiting, hiring, and managing them without support from your health plan. Alternatively, you can hire a caregiver who then works for your home health agency. This can help if agencies are short-staffed or don't have staff that meets your needs. You can find more information about your healthcare rights at disabilityrightsaz.org or call Disability Rights Arizona at 1-800-927-2260. The information presented is intended to be used for informational purposes only and is not legal advice. If you have specific questions or want legal advice, please contact a qualified attorney in your state.